and welcome to our 20th annual Hector P. Garcia Award Ceremony. This marks our 20th year commemorating Dr. Garcia's legacy, and so I'd like to take a moment to honor the person that started this award and continues to oversee it, Dr. Rebecca Saavedra. Please, can you please stand and come over? Thank you for guarding the legacy. Every year, we ask students that are in good standing, academic standing, demonstrate commitment to a personal and professional development of cultural competence skills, leadership, and service activities to submit an essay, telling us about their growth in cultural competency and how it impacts their clinical experiences. We have many extraordinary students across all schools, and it's quite a task to choose the best. I would like to take a moment to recognize the judges for the essays, Drs. Niesel, Ainsworth, Rojas, and Dorothy Piro. Thank you. Thank you for your years of service and dedication. This year, Dr. Rebecca Saavedra and I felt that students could also express their competencies through abstract submissions, and for others to view through a poster presentation, which are available for you to view in the foyer. This opportunity will allow students to express their story through pictures and data, and will also serve as an additional scholarship work for their course career. This year, 13 abstracts were reviewed by our faculty judges, and 10 were accepted to submit a poster. Our faculty have judged the posters by talking to the student authors, and scores will be tallied to announce the winner of $500 for Best Poster. Now I will introduce Ms. Catherine Donat, the president of the Latin Medical Student Association, to come up, please.
Good afternoon, everyone. Sorry about that. So my name is Catherine Donat. I'm the president of the Latin Medical Student Association here at UTMB. And I'm currently a second year surviving through med school. It's definitely rough, but I'm here. And it's my great pleasure to announce this year's essay competition winner, Mr. Ali Mahmoud. He is a second-year medical student pursuing the bilingual health track. He's been involved in social activism in his community since he was an early teenager, culminating in an invitation to the White House in 2014. Congratulations. And with the Outstanding Youth Leader Award presented by the Council on American Islamic Relations in Dallas, a social justice organization, in 2015. He founded and is the executive president of the America's first Muslim interest fraternity that has over 5 chapters nationwide. At UTMB, he's been active outside of school work by attending the Building the Next Generation of Academic Physicians, the BNGAP conference. The American Medicine Career Development Regional Conference that was geared toward helping minorities pursue academic medicine. He was also named Mr. UTMB by the American Medical Women Association, and he is also the president of the Muslim Medical Association. So please go ahead and help me welcome Mr. Mahmoud.
So a little bit of a preface to my essay. First, I want to thank Dr. Callender, the judges, Dr. Perez for setting this up, and Dr. Perez especially for kind of encouraging us to reach out. You know, when we're in medical school, it's hard to find time to do extracurricular activities, to try harder, to get involved in other things. And Dr. Perez is always encouraging us to, submit essays and go to conferences and things like that. And it had been on my mind for a while to write this essay until I walked into the library and there was a huge poster and face of Dr. Garcia, and I was like, okay, that's the essay I need to write. But to be completely honest, I didn't know too much about Dr. Garcia until I started to write the essay, and I wanted to learn a little bit more about his life. First thing I noticed about him was that he had wonderful hair, so I was already a little jealous of him. But when I read more about his life and what he accomplished, it really inspired me because it told me that doctors can do more than just help people. They can do more than just heal people, but they can become social activists in their society, and they can make and enact real change. He was involved in the United Nations. He was involved and awarded by the government. And to me, that was very impressive for a number of reasons. But the main reason being is that Dr. Garcia served as a check on this country. He served as a moral conscience for this country. And I feel that to be an important role for a lot of minorities in this country, to hold America accountable for who we say we are, and to continuously check us on that end. And so now I'll read my essay. All right. So I like talking kind of off the off the bat a little bit more. I don't like reading off papers, but that's what I was asked to do, so I'm going to do that. Luckily, this isn't an essay reading contest, so. All right. Cultural competence is a skill that takes years to develop, but is truly manifested in a few sacred moments. It's a skill that is most relevant with patients of a particular racial, ethnic, religious, or sexual minority. And in today's clinical atmosphere of shorter patient interactions, being prepared to act properly around patients of different backgrounds is essential to being a competent physician. The uniquely beautiful quality about cultural competence is that it cannot be rushed or faked. It is not something that can be picked up by simply reading a textbook. A mentality of tolerance coupled with dedicated time spent learning about another culture, language, or way of life is the only way for a physician to exhibit true cultural competence. Without adequate work, a physician will not have the ability to truly connect with patients from minority backgrounds in a way that is meaningful to them. As someone who came from a religious and ethnic minority that has had a history of being marginalized in this country, I was drawn to the idea of activism and tolerance at a very young age. I've been active in volunteering within my local community since my early years in high school, through attending interfaith events and raising awareness on issues of discrimination. This inspired me to pursue a degree in sociology in college, as well as start a minority social fraternity that was the first of its kind. These activities did not only allow me to build pride in my religion and heritage, but it allowed me to understand and appreciate the struggles of other backgrounds in my community as well. Social justice and tolerance could not be monopolized by any particular group. The more I worked with my community and learned about others, the more I realized that the problems of my community were often part of a larger systemic issue in our country. Our community's problems were simply a different form of the same problem that other communities were facing. The true solution was in working with other community activists, understanding their struggles, understanding their strategies, and figuring out how we could work together to make our common home a better place for everyone. Upon being accepted to medical school, I decided that it was time to take what I learned working within my community and use that knowledge and experience in my career by exhibiting cultural competence toward other backgrounds. Since beginning medical school a year ago, I have not only been involved with student organizations of my own background and others, but I've pursued the bilingual health track with the help of Dr. Perez, interacted with the Hispanic Center of Excellence, again, with the help of Dr. Perez, volunteered at St. Vincent's Clinic, was named Mr. UTMB by the American Medical Association, and attended the Building the Next Generation of Academic Physicians, or the BNGAP, American Medicine Career Development Regional Conference that was geared toward helping minorities pursue academic medicine. These experiences have not only enriched my understandings of other cultures, but have revealed the use of cultural competence. This has empowered me to learn more about other people so that I can be the best physician within my capabilities. Story time. One instance was particularly revelatory. I was with my attending physician on a preceptorship over the summer. We were seeing an elderly Hispanic woman who had diabetes. She could not speak English. She had peripheral neuropathy, and my physician checked her feet for any ulcerations. After checking her feet, he began to tell her grandson, who was serving as her translator, about all the maintenance and precautions that his grandmother needed to take to avoid further complications with her feet. He mentioned that if she wasn't he mentioned that if she wasn't careful, she could be at risk for amputation in the future. The grandson turned to his grandmother and uttered, "Just make sure to check your feet," in Spanish. He had been on his phone while the physician was speaking and was not paying close attention to what he was saying. Knowing that I spoke Spanish, my attending physician looked at me and kind of urged me to intervene. We both knew that the grandson had not done an adequate job of translating. Everything I learned about Hispanic culture, cultural competence, and Spanish rushed through my head. It was time for me to act. I took a deep breath and translated what the attending physician had wanted to say to the best of my ability. The grandmother listened attentively. I asked her if she understood what I said, and she nodded. I asked her if she had any questions, and she said that she did not. I then turned to her grandson and told him in Spanish that his grandmother's condition is serious and that she depends on him. I probably should have told him in English, because then I kind of embarrassed him in front of his grandmother. But it's okay. We live and learn. I told him that without his help, we cannot help his grandmother. He was a part of a healthcare team, and his grandmother needed him. To my surprise, the young boy agreed with what I was saying and gave his grandmother a hug. It was like a movie, I swear. I was like, where's the cameras? The value of family was something that was deeply instilled in him already. He just needed a reminder. His grandmother looked at me with approval and smiled. These moments meant the world to me. While it may not have been a textbook situation of how translation in the clinic should have happened, it was a reflection of that reality and a wonderful learning experience. I learned that day that being competent with other cultures was not only important for improving the delivery of healthcare, but for building trust in patients and their families. Building trust for physicians is just another way of breaking down the barriers to healthcare. When the barriers are being broken down for members of a minority population, true equality and tolerance are that much more accessible for them. It takes years for physicians to build true cultural competence that is expressed in only a few moments, but those moments can be the most powerful and meaningful moments in one's career. It is through these small instances that we can cumulatively help the situation of entire peoples. Physicians who are culturally competent are more than just healthcare workers. They're advocates of social justice. Thank you.
And we have something that you would like. Dr. Callender?
Stand over here. We'll put you in the center.
Sure.
Thank you, Ollie. That was outstanding. Wonderful. I want to join Dr. Perez in welcoming you to our annual Hector P. Garcia Cultural Competency Award Essay Competition Celebration. Thank you to all of our student participants for putting so much time into your submissions. We all learn from them and appreciate your efforts to help us learn. This year's celebration comes just months after the release of a new book by Dr. Garcia's daughter, Cecilia Garcia Akers, who is here with us today. And you see some of the books over on the stand over here, as well as a depiction in the photograph. The book is entitled The Inspiring Life of Texan Hector Garcia, and it shares Cecilia's perspective on her father's remarkable achievements and sacrifices as a physician and pioneering activist. It's a reminder of the extraordinary life and legacy of Dr. Garcia, and of course, he is one of our most distinguished and influential alumni. He's a 1940 graduate of our School of Medicine and certainly was known throughout Texas and our nation as someone who worked tirelessly to make life better for all Americans, especially Mexican Americans. He believed no one should be denied access to health care for any reason, especially ethnicity or socioeconomic status, and everyone had the right to an education. There's now a statue on the Texas A&M Corpus Christi campus that stands as a memorial to his legacy, and it bears his personal motto, "Education is our freedom, and freedom is everyone's business." A decorated World War II veteran, Medal of Freedom recipient, we have the medal here, UN ambassador and devoted physician and family man, Dr. Garcia taught us that we can all make a difference against injustice. His list of accomplishments goes on and on and on. It's a testament to an outstanding individual who symbolizes everything that UTMB has stood for from its founding day, now 125 years ago. His legacy certainly continues to inspire us. The stories, we see the poster that helps describe his many accomplishments and his influence. It's aligned, his work aligned with our effort to improve health for the people of Texas and around the world through education, research, and patient care. And of course, Dr. Garcia and all of those with him, people who have been at UTMB for the entire 100, or over the course of the entire 125 years, know that diversity plays a very important, or knew that diversity plays a very important role here. That is why it is a core value, and it's helped us achieve excellence over the course of our history. Our commitment to diversity can be seen all across our campus, in our UTMB family, from our employees around the state to our students enrolled in each of our schools. Since the early 20th century, our School of Medicine has had one of the most diverse student bodies in the nation. In 1921, UTMB graduated its first Hispanic medical student, Daniel Syons. And in 1953, a UTMB medical student named Herman Barnett became the first African American to graduate from a Texas medical school. And today we remain a national leader in recruitment, retention, and graduation of students from ethnic groups that are underrepresented in medicine. From 2000 to 2015, UTMB School of Medicine ranked first nationally in the number of Hispanic graduates, fourth nationally in the number of African American graduates, and second nationally in the number of underrepresented minority graduates. But as Dr. Garcia's legacy reminds us, we can't stop with those statistics. We must ensure that our students and our faculty and our employees are culturally competent and that they respect their colleagues and patients' individual culture, language, and history. The essays inspired by the Hector P. Garcia Cultural Competency Award reflect our longstanding commitment and remind us that Dr. Garcia's legacy is alive and well in our students today. That is something to embrace, and we work together to define the future of healthcare. At this time, it's my great pleasure to introduce our keynote speaker, Dr. Eduardo Sanchez, Chief Medical Officer for Prevention for the American Heart Association. Dr. Sanchez has devoted himself to public health throughout his medical career and brings an interest and experience in prevention and population health to the Heart Association. In previous roles, he served as Vice President and Chief Medical Officer for Blue Cross and Blue Shield of Texas, where he focused on worker and worksite wellness, clinical prevention, and chronic disease management, particularly for diabetes and cardiovascular disease. He has led the Institute for Health Policy at the University of Texas School of Public Health as director, and has served as commissioner for the Texas Department of Health, where he helped manage the consolidation of the state's public health, mental health, and substance abuse agencies into one health-related agency, the Texas Department of State Health Services, which he led for 2 years. As both commissioner and the state's chief health officer, Dr. Sanchez helped direct the health and medical responses to the hurricanes Katrina and Rita. We know a little bit about how that goes. He currently serves as chair of the National Commission on Prevention Priorities and the Texas Public Health Coalition, giving an important voice in the statewide national dialogues concerning efforts to prevent disease and eliminate health disparities. He also serves on the Institute of Medicine's Roundtable on Obesity Solutions and the Board of Directors of Trust for America's Health, Academy Health, and the Catch Global Foundation. We are so honored to have him here with us today. Dr. Sanchez.
Good afternoon, y'all. You know, one thing that's not in my bio that may be the most important thing as it relates to today's event and today's commemoration is that I am a proud graduate of Corpus Christi Carroll High School. And I grew up in Corpus Christi. My family moved in the circle of the Garcia family. Hector wasn't the only doctor in the family, and my parents moved in that circle. I wasn't mature enough or sophisticated enough to understand how important those connections were. But as I reflect, and I reflect on the life of Hector P. Garcia, one can't help but believe that I might have been touched a little bit by at least 2 degrees of separation. A couple of things. Ali Mahmoud, congratulations to you. What an awesome essay. I thought about some interpretation experiences that I had and translation experiences. I'm going to start with a story that I thought was kind of funny, but it speaks to the challenge of providing care for people who speak a different language than you do. I was a clinician in a federally qualified health center in Austin, Texas. I'm proud to say I came up in an FQHC. I learned about caring for folks in a setting that was dedicated to taking care of people who were uninsured and underinsured and a quite diverse population. Austin had a refugee settlement center at the time. And a woman was brought in by somebody who worked at the settlement center. She was from Bosnia, and I was told this woman would translate for me. Patient comes in, and the woman who's with her comes in. And as you learn, when you're working with a person who's got an interpreter with them, you look at your patient. So I'm looking at my patient, and I say, Mrs. Blank, my name is Eduardo Sanchez. I'm your doctor. How can I help you? And I'm not joking. The translator says, Mrs. Blank, this is Dr. Sanchez. He's your doctor. How can he help you? And I refrained from laughing because it wasn't really a laughing matter. But there did come a point where I said, you know what? I think I can manage this. So I had another situation. I'm looking for my comments here. I had another situation where 2 persons came in to see me who phenotypically they looked like they were South Asians. I came to learn that they were South Asians, but 2 people, one was an elderly woman and the other was a man probably in his mid-20s. And much like the situation with the woman from Bosnia, I spoke to this person in English, and this other person spoke to her in English as well. But that time I asked, well, I don't get it. I'm talking in English and you're talking in English. And he went to the trouble to explain to me that they were both from India. They were from different states in India. They actually spoke different languages in their different states. They both spoke Hindi. She did not understand my accent, but could understand his accent when he spoke in English. And I'll tell you one more story, just because this is some of the challenge, not only with cultural competence but linguistic competence. So when I was a medical student at UT Southwestern, I had a patient from South Oak Cliff who had very, very serious disseminated tuberculosis. He was in the intensive care unit. And my attending was a Dr. Beer from New Zealand. And we went in to see, we'll just call him Mr. Jones. And I asked Mr. Jones, how are you doing, Mr. Jones? And Mr. Jones said to me, I'm doing all right. And he said a few other things. And Dr. Beer looked at me and he had no idea what Mr. Jones had said. And so then Dr. Beer speaks to Mr. Jones and says, he had a nasogastric tube, and he says, is that nasogastric tube affecting your gullet? And Mr. Jones had no idea what he was talking about. The only time he'd ever heard about a gullet and an animal was a bird. And so he had no clue, and these 2 people could not communicate. I was the interpreter for 2 people who spoke English. Now, in every single one of those instances, I think the thing that I would say to you is that cultural competence starts with caring. And in every one of those instances, the people involved, including the interpreter who really wasn't interpreting, was trying to demonstrate that she cared. And sometimes, even if you can't speak the language, sometimes even if you fumble over your words, sometimes even if you commit missteps as you are trying to communicate and provide care to individuals, if that sense that you care is conveyed, you've made the most important big step towards cultural competence. So I'll start there, and I haven't even gotten started with my comments. Dr. Perez and Dr. Saavedra, thank you for inviting me. Jim and Cecilia, thank you so much for being here and connecting us to the Garcia family. Now I will start with some comments that I wrote down. You may have gathered just from those stories, I'm a person who can digress again, and forget where I was. So I need to write things down sometimes just to make sure that I deliver the message that I'm trying to deliver. It is truly an honor to be here today to honor Hector P. Garcia and to honor folks who are challenged to think about his legacy and put on paper what they think, and for us to recognize those individuals. So again, I want to congratulate Ali Mahmoud. I also want to congratulate the persons whose posters are out in the hall, and I encourage you to go and look at those. A couple of things that came to mind. Again, it is about challenging people to think about this notion of cultural competence and quality care on the one hand, put it to paper, and I'm reminded by the posters I saw that cultural competency doesn't stop at the United States. And so it is indeed about how we think about the notion of cultural competence as it plays out in other places, and also how we engage internationally and apply that cultural competence. Some call it cultural humility out in the world as we are out and about. As I said earlier, I grew up in Corpus Christi, and my parents were proud to know members of the Garcia family. And I myself am very proud to know that Dr. Garcia started his groundbreaking civil rights work in South Texas to address the injustices experienced by persons of Mexican descent. He was brave, he was bold, he made a difference. But we have work to do. We have a lot of work that still needs to get done. Because of the work of persons like Hector P. Garcia and Cesar Chavez and others, we honor Hispanic Heritage Month in the United States from mid-September to mid-October. So if you didn't know, and I imagine everyone here knew, yesterday was the start, and you may also know that today is Mexican Independence Day, 206 years of freedom for Mexico from Spain. Cesar Chavez is quoted to have said, "Preservation of one's own culture does not require contempt or disrespect for other cultures." That's a reminder to us that even as you think about cultural competency, no matter what your culture of origin is, it doesn't mean anything other than being respectful of others and being humble about your culture as it relates to other cultures. So I say, for all of us, let's proudly celebrate Hispanic culture in the United States. But these are interesting times. It's difficult for me not to take personally the negative characterizations that I hear, and I suspect all of y'all hear and see over media channels. In public speeches, Hispanics are described today too often by some in very derisive ways. And people loudly yell for a wall. Yesterday's headline in the Dallas Morning News, and I hope in newspapers all across Texas, was quite heartening. Most Texans oppose a border wall, according to a Texas Lyceum phone-based poll. The breakdown is a little telling, and I'll come to that a little bit later. The truth is that millions of Hispanics live in communities in Texas and across the United States, doing good, honest work and raising families. Millions are citizens. Millions are multi-generational Texans. We're here before people who call themselves native Texans were. Native Texans, multi-generational Americans. Millions, like myself, are first-generation Americans, and millions are immigrants, documented and undocumented. Many of us have enduring and continued connections with our family countries of origin. But let me repeat, and I think I've heard it already, my professional and personal experience and the evidence suggests that Hispanics in the United States are mostly, like way beyond mostly, 99.9% good people seeking educational opportunities, good paying jobs, safe places to live, and good health, just like most other people who live in the United States striving for the American dream. In that poll that asked about building a wall along the US-Mexico border, 75% of Hispanics who were surveyed oppose a wall. 73% of African Americans who were surveyed oppose a wall. Only 42% of whites who were surveyed opposed a wall. So I have to say it is both heartening, but sometimes disheartening that this is the current state of affairs for Latinos in the United States. Tremendous progress has been made since the pioneering activist days of Hector P. Garcia and the GI Forum. It could not have been an easy thing to be Hector P. Garcia when he was doing what he was doing. It was not the America of 2016. It was a not so kind place to people of color when he was doing the work that he was doing. My mother-in-law was born in Juarez and raised in El Paso. She remembers when speaking Spanish in her public school was the worst thing you could do, could get you expelled. So there is work to do. The UTMB Hispanic Center of Excellence manages the Hector P. Garcia Cultural Competency Essay Award and the abstract poster presentation that we are a part of today, and which celebrates Dr. Garcia, as we heard, the distinguished 1940 graduate of the School of Medicine, and which recognizes those students whose essay or abstracts demonstrate both cultural competence and a commitment to providing quality health care to all. Congratulations to all of you again. And thank you for reminding us of how important those two things are. The center recruits and mentors a diverse population from across Texas into UTMB and seeks to graduate, these are important words, linguistically appropriate, culturally competent, bilingual physicians to better serve the healthcare needs of all Texans. These are laudable goals. Today, I want to talk about cultural competence, diversity in medical schools, health and healthcare for Hispanics in Texas, and the importance of education to achieve the goals of the center as stated. As I said before, these are truly interesting times. I suspect that for most of us in this room, cultural competency is a virtue. It's something worth pursuing. The National Center for Cultural Competence defines cultural competence as, quote, a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals and enable that system, agency, or those professionals to work effectively in cross-cultural situations. That's a pretty important thing. Ali made clear that that's a pretty important thing. The posters make clear that that's a really important thing. 20 years of this award remind us over and over, and the legacy of Hector P. Garcia is about that. Cultural competence is important in health and healthcare, but in many other sectors and circumstances in the heterogeneous society that we live in, cultural competency is absolutely necessary. But I worry in these times that for some, cultural competence is synonymous with political correctness, a term that's loaded with negative connotations. The definition of politically correct is conforming to a belief that language and practices which could offend political sensibilities, as in matters of race or sex, should be eliminated. But I want to tell you, folks, if political correctness means that Hispanics and others in the United States hear less negative stereotypes and derisive descriptions of themselves or Hispanics, then I am all for political correctness. And if political correctness means thinking thoughtfully about the words that you use to describe people or situations, then I am all for political correctness. Because if we're going to live and be culturally competent, sensitivity is the other side of tolerance. And using our words carefully and not inflaming, and whether it was intentional or not, apologizing when those words come out. We slip. We slip because we have idioms in our language that are all about insensitivity. When you utter them, step back and think to yourself, man, I said the wrong thing, and say it out loud. If that's political correctness, I'm all for political correctness. I can't help but think that those who deride political correctness are the very people who might most benefit from being more culturally competent and adopt a higher degree of cultural humility. Remember, 3/4 of Hispanics and Blacks say no wall. Just over 50% of whites in Texas support a border wall. So what is the makeup of the Texas population right now? In 2014, among 27 million Texans, 42.5% were white, 11.5% were Black, 39.6%, statistically speaking, I'll just call it 40%, are Hispanic. 6.3% were categorized as other, according to the Texas Demography Center. We are on the cusp of becoming a state where there's an equal percentage, equal number of Hispanics and whites. We've got to have a different way of thinking about what our state is about. The demographics have shifted over just 20 years. The Texas demographic profile in 1995, 59% Black, mean white, 12% Black, 27% Hispanic, and 2.5% other. Things have changed, and things will continue to change, and they're changing nationally. And by the year 2050, 25% of the population will be Hispanic. And more importantly, perhaps, by the year 2050, people of color will outnumber white people in the United States of America. And if we don't get our head around and get our arms around cultural competency, it can't be a good thing. And if we don't begin seriously thinking about the good part of political correctness, it can't be a good thing. When we look at births in 1995, they were predicting where we were going to end up. In 1995, 42.7% of births were to white women, 12% to Black women, 42.4% to Hispanic women. So what's going on today in terms of births in Texas is predictive of where we're heading over the next decades. So now let's ask, how do Texas medical schools compare to the population of Texas, the profile of medical schools? How are we doing in our efforts to graduate Hispanic physicians in Texas? We've heard about UTMB doing a fabulous job. We've got work to do across the state. In 2015, the race ethnicity profile of 2015 Texas medical school graduates was 52% white, 5% Black, 7.5% Hispanic, 24% Asian. And while there is no doubt that in many medical schools, more Blacks and Hispanics are graduating today than were graduating a decade ago, we will not have a workforce of physicians that looks like our population at this rate for a very, very, very long time. We got to step up our game. We've got to do things a little bit differently. In the United States in 2011, 6.1% of medical students were Black, 8.5% of medical students were Hispanic. Hispanics and Blacks clearly underrepresented in Texas medical schools and in the nation, and this disparity has to be eliminated. So Hector P. Gonzalez sought to undo injustice. And he understood the importance of education in sustaining equal opportunity. The equal opportunity for Hispanics and everyone else. As we heard, he said, education is our freedom, and freedom should be everybody's business. Getting more Hispanics and other underrepresented groups into Texas medical schools, into other health professional schools, into engineering programs, into business schools will take focusing on the educational pipeline from early childcare to elementary, middle, and high school and on to higher educational settings. Hector P. Garcia had it right about education, but there is work to do. The gap between the high graduation rates for whites and Asians in the United States and the lower graduation rates for Latinos, African Americans, and American Indians has to be completely eliminated. Not by bringing whites and Asians down, but by bringing the graduation rates of Latinos, African Americans, and American Indians up. This is critically important in a world, in a society where critical thinking skills are put to the test every single day. Whether it's managing your phone, where my 12-year-old can do better than I, or figuring out where to put your distributions or your deferrals for your 401k, or figuring out which variation you're going to choose for the coming year for your health plan. We live in a complicated world where thinking has to be a part of what you do every single day. But there's more to it. There's more to critical thinking skills. There's the higher paying jobs that come with an education, but also higher education levels predict better health and longer life. And I will try to convince you by the time we're finished that doctors need to begin thinking about things other than just prescribing medications if we indeed are going to be part of improving the health status of people in our communities and in the United States. Roughly speaking, there is a threefold difference in the mortality rate in those without a high school degree compared to those with some education after high school. Not having a high school degree is 3 times more deadly than education after high school. I'm going to break the numbers down for you. We measure mortality rates by deaths per 100,000. And the death rate for people 18 to 64 who have not graduated from high school is about 550 deaths per 100,000. If we were to compare that to the death rate among people with 1 year of education beyond high school, I'm not talking about people like Dr. Callender or myself who have more than 1 degree. I'm talking about people who go 1 year after, they may not even get the associate degree, 1 year of education after high school, that mortality rate drops to about 250. Might even be 225. I tend to hedge my numbers. I said 3 to 1. I'm actually correct. But when I say the numbers, I just cannot believe that it could be that disparate a difference. Education may be the single most important thing that as a society we could do to reduce the likelihood that people are going to die prematurely. People with a high school education and beyond, less likely to be smokers, less likely to be people who don't eat the right kinds of foods most of the time, less likely to be people who don't move their bodies. So there's lots of reasons why education may be the most important prescription we can write. So this brings me to one of the reasons that education, particularly for underrepresented populations, is so important. Because not only is this about individual health and well-being, but when we look at the high-end workforce in the state of Texas, the United States, those with higher education, higher paying jobs, those are not folks that look like the general population that I described to you. And they certainly don't look like the lower-end workforce that is emerging in Texas. A heterogeneous population in our state that looks different depending on region, city, and neighborhood. We need to produce a workforce, including a physician workforce, that looks like the state's population. And it's going to be really, really tough to do if we're not graduating high school students, all high school students, at a very high rate. At this time, generally speaking, Hispanic household income in Texas is lower than that of whites and blacks. And as for health care, Hispanics are much more likely to be among the more than 5 million Texans who do not have health insurance in Texas. The state, oh, by the way, with the highest uninsurance rate in the United States. Perhaps a legislature that looked more like the population of Texas would have a different policy agenda. Perhaps a legislature that looked like the population of Texas would pursue a different education agenda, and perhaps make it absolutely a thing that in all communities, education was supported with the resources necessary to get the results we're looking for. And we would stop with the debate about why we shouldn't expand Medicaid in the state of Texas, and would get to the businesses of making sure that people had access to medical care. Understand that expansion of Medicaid is more than just getting access to the care itself. In those states where Medicaid has been expanded, families who otherwise would be burdened with medical debt are not being burdened with medical debt. Families that are burdened with consumer debt are less likely to be burdened with consumer debt. So when we talk about fiscal responsibility and that we should be responsible, we might be able to help people who are at the lower end of the income continuum by providing them what some believe is the right to have access to health care. I kind of went off of my speech a little bit. Remember I told you I digress? But that's a really, really important point. It's an important point that it's more than just getting medical care. It is about parents who don't have to worry about not being able to pay that bill. And you can be a much more pleasant, happy parent when you don't have to worry about bills. I was sharing with President Callender that yesterday 2 things happened in my house that would cripple a low-income family, cripple them. A flat tire that had to be replaced. They're not cheap these days. And my wife, who had run a red light trying to get my daughter to school on time, and it got captured on camera, had an $80 bill to pay. That's $155. And I'm not saying that it's a trivial amount of money, but it's not going to paralyze my family. There are families in Texas, $155, it stops them dead in their tracks. And when that happens, ladies and gentlemen, and the next day, child has an earache, they're not going to the doctor's office. Now, that might be the wrong example because most earaches don't need to see the doctor. But you know what? They have to intentionally say to themselves that they're not going because they don't have the money, not because they know that 90% of the time it will take care of itself. Okay, now let me find my way back to where I was. So answer my question, and despite what I said, is it enough to have health insurance and access to quality primary care? Ladies and gentlemen, it is necessary, but it is not sufficient. The evidence suggests that healthcare by itself is necessary, but not enough to optimize health. I ask a question, I'll ask you to raise your hands. Have any of you heard the line that one's zip code may be more predictive of health status than one's genetic code? Raise your hand. Zip code more important than genetic code. I promise you that we're doing a lot of work on this thing called precision medicine. And it's interesting, it really is, to understand the genetic code and be able to break it down. And not enough work is being done on zip code, but I'm comforted by the emergence of epigenetics. How many of you have heard of epigenetics? Raise your hand. So epigenetics is this notion that in addition to the hardwired genetic code, the environment that you're in can trigger some of those genes. And so now I am no longer worried that genetic code and zip code aren't somehow interrelated. There is an interrelationship, and I look forward to that place emerging and us beginning to think about how we make use of that knowledge. So it may be that our notion of cultural competence, which does include race, ethnicity, country of identity or origin, culture of identity or practice, and language spoken, should include knowledge about where people live, what people's jobs and income are, and what their years of education are. So in this room of future physicians, teaching physicians, and other clinical care professionals, I have a last question, and I'm winding down. So it's a little bit like we are not quite at 10,000 feet, but we're getting there, ladies and gentlemen. I recently heard a neuroscientist talk about a vicious cycle that is germane to this question. How many of you realize that lead in the bloodstream of children has some pretty damaging effects neurologically and intellectually? Raise your hand. So some researchers at University of Texas, Dallas are suggesting that food insecurity may have some lasting, hardwire, neurologic changing effects in the brain. Low income increases the risk of food insecurity in families. Childhood food insecurity seems to result in observable neurocellular changes in the brain associated with poor impulse control. Poor impulse control is associated with poor academic performance, is associated with risk-taking behavior as well. Poor academic performance is associated with back to where we were before, not graduating from high school, low-income jobs, and the cycle really continues. Poor impulse control also means higher likelihood of the things I listed before: smoking, poor eating habits, irregular physical activity, excessive alcohol consumption, and risky sexual behavior. Again, things continue. Should physicians be asking about household income when they are interacting with patients? The American Academy of Pediatrics believes that yes, those questions should be asked, because there are things we know as physicians that we might want to do. The kinds of things that Hector P. Garcia began to touch on, which is it may be more than just writing a prescription. It may be about advocating for what happens in schools, and it may be for advocating for what happens in neighborhoods. Should physicians advocate for animal control in neighborhoods where loose dogs are a problem? Well, if your patients have type 2 diabetes and you're trying to get them to walk, or you want children to be able to walk to and from school, loose dogs is a problem. And if you're not a doc who understands that and knows that, you might not even think about that. So I'm going to button this up. In closing, again, I want to thank all of those recognized today, and I want to leave you with food for thought. We must provide culturally competent, considerate, compassionate, quality care, but we have to think of cultural competency in a more expanded way. We need culturally competent physicians, diverse in their makeup, culturally competent, diverse health professional workforce, working in culturally competent health systems. We have to understand that context matters: cultural, linguistic, and socioeconomic. And we should be advocating or pushing for the following things: trying to better understand the context of our patients' day-to-day lives, not just the language they speak at home, but what's going on day to day. Because if you just got a traffic citation and a flat tire, maybe you're not going to be able to fill the prescription for blood pressure medication. There are some who are thinking about prescribing healthy food for low-income families and connecting them to the resources where that can happen. Think about that. We need to push for high-quality education, because the pipeline starts in early child care, goes to K through 12, and then results in those who might end up in an institution like UTMB. So, rather than first do no harm, perhaps we should strive to, above all, do some good. Thank you for being here, and thank you for having me.
Thank you, Dr. Sanchez. I would like to announce the poster winner. Paige Hoyer, Cato-Cots versus Lumbreras Rapid Sedimentation Test to evaluate helminth prevalence in the setting of a school-based deworming program. Congratulations. She will receive $500. Ms. Cecilia Akers.
I want to thank you again, Dr. Callender, for having this wonderful event to honor my father. I know that he would be so happy that he was remembered this way at the school that he so loved. It's been a great year for us. We did appoint a new foundation board member who is here with us today, Mr. Moses Estrada from Corpus Christi. He is the commander of the Dr. Hector P. Garcia Founders Chapter of the American GI Forum. He is now on my Dr. Hector P. Garcia Memorial Foundation Board of Directors. Thank you for coming, Moses. Thank you. We have successfully, after 25 years, had my father's documents transferred to History Associates in Maryland for digitization and categorization. Finally, after 25 years, Texas A&M University, Corpus Christi, has those documents there. It will be December 2017 before they will be able to be viewed by the public. So that was just a $610,000 investment into that project. So we're just very thrilled with that. We're happy. The Dr. Hector P. Garcia Memorial Health Clinic will be opening in December of 2016. We'll start seeing patients probably in January. It will be replacing the old Spahn Memorial Hospital, which will be demolished in 2018. So that is a 44,000 square foot healthcare facility to help people manage their chronic diseases. That's going to be opening up in just a few months. So we're just so excited about that. And somehow I managed to write this book. I don't know how I did it, but it's been a wonderful, wonderful thing. I always told my husband, Jim, I said, you know, if I sell 500 copies, I'll be happy. Well, it's in its second printing. It was in its second printing probably April the 4th when it came out. They called me and they said the book is already in its second printing. So I'm real proud about that. The book sent me to the Library of Congress, where I gave a lecture on my father in the book on May the 20th, which was really historical. For one, to have my book there, the Library of Congress. They do not, unfortunately, celebrate Hispanic heritage there like we do here. So they knew nothing about my father, absolutely nothing. And the Veterans History Project, which was started in 2000 under President Clinton, the first President Clinton, he started that Veterans History Project. It took them 16 years to learn about Dr. Hector Garcia and his contributions to this country as a soldier and a physician. So an officer. There were so many things I learned about my father writing this book. Number one, he was not even a U.S. citizen when he served in the U.S. Army. He didn't become a citizen until November of 1946. So that's pretty remarkable that he served this country all over the world, taking care of soldiers, not even a U.S. citizen. What does that say about an immigrant? You know, it just really upsets me when I hear this immigrant talk. Both of my parents were immigrants. And here he served this country, was awarded many awards from the U.S. Army, this government, and he was not even a U.S. citizen. I mean, that says a lot about him. And his devotion to this country and to his patients. And so in our travels, Jim and I travel all over the country now, promoting the book and talking about my father. The standard is, did you make the book? In other words, where did Cecilia write about you in your book? Which is pretty funny because everywhere I go, they go, did you make the book? You know, I hear this story. Did you make the book? Did you make the book? Well, I do want to say that UTMB did make the book. And I'm just so happy about our relationship with the school that I graduated from as a physical therapist. And it taught me so many things. And I did want to present Dr. Callender with his own signed copy of the book. So Dr. Callender is in the book, and Dr. Saavedra so graciously wrote the introduction to the book. I really wanted to keep it very personal on a human level. You could talk about his accomplishments for years and years, all the wonderful things he did, but what kind of man was he? What kind of father? What kind of husband? What kind of doctor? What were his sacrifices? What was his suffering? And I think that I did a good job on that. It was really, really hard, and I want to thank my husband for helping me, and my sister Susie and her partner Nell, because they helped me through it. It was really, really hard, especially since they only gave me 6 months to write it. So 33,000 words in 6 months, and they gave me 5 months to get them 70 photographs. They only rejected 5 out of 75 because we had some from the 40s that I sent over there. They rejected 5, but they did accept 70. So here's a book, Dr. Callender, and come up and get your autographed copy. Here you go. Thank
Can we
you.
get a picture?
Sure, of
That'd be
course.
okay?
Here we go.
Well, thank you, Cecilia. Thank you so much for being here. We appreciate you and Jim and Susanna and Nell coming all the time and helping us every year celebrate Dr. Garcia, but also trying to keep his important legacy moving forward. Dr. Sanchez, thank you for being here. Our mission, as stated, is to improve health for the people of Texas and around the world. And we take that very seriously. We could insert all the people of Texas, not just some of the people. And so your words are inspiring to us. We believe here, at least we understand the issue of the social determinants of health. And we're with you in terms of moving from the definition of evidence-based care that deals only with prescriptions and therapies to understanding fully what's happening around patients and how it impacts their lives, and broadening those definitions so we include all Texans and not just those that are fortunate enough to be able to access healthcare on a regular basis. Well, thank you all for being here, for helping us celebrate Dr. Garcia and his marvelous work, an important part of our history here and an element of UTMB's commitment to diversity. That's so important. It's a critical part of our culture. As I said, it's a core value. And I appreciate all the work of everybody in this room helping us carry that commitment forward. Please go, remember Dr. Garcia and his work, and help us keep moving forward in terms of improving health for all Texans and all people around the world. Thank you and have a great afternoon.